Hi guys, today I'm back with a topic which is pretty old. In fact, I think I myself have done a video quite a few years ago, which is about NT scan. Now, why am I doing it again? Or maybe there are lots of videos circulating around an NT scan topic in the internet. What I wanted to tell you about is how it has changed over time. So NT scan was not a scan that we used to do when probably I was in MBBS. It was just an upcoming thing at that point of time. By the time I started practicing my fetal medicine, it became one of the very important things to do, but still was being advised only for high-risk women. And today it has become as important as anomaly scan in any pregnancy, be it high-risk, low-risk or no-risk pregnancies. What has changed? The technology has changed, the understanding of pregnancy has changed, the theories have changed, the treatment modalities have changed, preventive medicine has come into picture. Now, why all this for an ultrasound? So, NT scan, like all of you or most of you might know, is being done in the end of first trimester and the beginning of second trimester, which is at around 11 to 13 weeks. Previously, we used to just concentrate on one single problem that we used to find out in an NT scan, and that was a risk of Down syndrome. Down syndrome is a genetic problem. Few markers could be identified on an ultrasound, and we could think about the possibility of Down syndrome in a child, and we could test further and give a convincing answer to the parents to be. From that, where it started, it went on, adding on things, markers for other diseases as well. Now, what other diseases? NT scan can also look at the blood flow to the uterus at the time of 13 weeks. And that blood flow can tell us about your risk of getting into placental problems in pregnancy, which are mainly two: the risk of hypertension in pregnancy and also the risk of fetal growth restriction in pregnancy. These two are so important, probably much more important than the evidence of Down syndrome in a baby, because both of them are very relevant and more prevalent in our Indian population. So why shouldn't we know about it? In addition to that, it also tells us about other problems like bleeding in pregnancy. A placenta is sitting lower down in the uterus. There is a risk of bleeding in pregnancy. The cervix is little short. You have a chance of preterm labor in pregnancy. You have some fibroids, ovarian cysts. We can look for them also in pregnancy. And the technology part that I was talking about. The ultrasound machines in today's world have improved so much that we can do a mini anomaly scan at the level of NT scan itself, which means we have the capacity to do and rule out gross anomalies of the head to an extent of the face, of the chest, of the heart, of the limbs, of the spine, which when I was training for fetal medicine would have been a distant dream. It was something only specialized people were even attempting to do. Why? Because the machines at that point of time were not that great, and we were looking at a very tunneled vision of looking at Down syndrome alone. Over the period of time, we have accumulated so much of data, which is still growing by the way, that we can look for various other problems at the NT scan level itself. And if found out, like always we know, knowledge is power. We can counsel the parents to be accordingly, probably prevent preventable problems like preeclampsia and fetal growth restrictions, counsel them accordingly as to how to minimize their issues, and if required, take care of any future prenatal and postnatal visits accordingly. So don't you think, like me, that NT scan is one of the best scans that you can do in your pregnancy? I'm not belittling the other scans, but today an NT scan holds so much of value to talk about how a pregnancy would move forward. So I think all pregnant women should make it mandatory that they would get a good NT scan at around their 11 to 13 weeks of pregnancy. Thank you. I am Dr. Anu Joseph from Trinity Healthcare Clinic, your neighborhood obstetrician, gynecologist, and fetal medicine specialist.